Assalamu alaikum. Now, let's dive into mechanical complications of acute MI. This box is a very high yield box, so try to remember. So, I remember the complication like pitfall. In the early 90s, we played this game like pitfall. Okay, papillary muscle rupture, interventricular septal rupture, and free wall rupture, and finally the left ventricular aneurysm. So papillary muscle rupture, go to the prom like papillary muscle rupture, RCA, and oh my heart problem like severe pulmonary edema, there may be respiratory distress, and the most important topic, the most important thing you have to remember in this aspect, like in papillary muscle rupture, RCA, right coronary artery, usually papillary muscle rupture, the time course is it happens within 3 to 5 days. There may be severe pulmonary edema, and there may be new early systolic murmur. This is very high yield. Papillary muscle rupture is early systolic murmur, and uh, I have said the prom like M for MR. So PROM, prom. Papillary muscle rupture, RCA. Oh, my heart problem, early systolic murmur, and MR. Then interventricular septal rupture. In these two, the papillary muscle rupture and interventricular septal, usually within 3 to 5 days. Interventricular septal rupture is LAD or RC. If it is apical septal, then it is LAD. If it is basal septal, then it is RCA. In here, in interventricular septal rupture, there is hollow systolic murmur, hollow systolic murmur. There will be left to right ventricular shunt. In here, there will be gain hypotension, cardiogenic shock, these and that. But for diagnosing and picking the key is the must to deal with the question. Free wall rupture, free 5 within 5 days up to 2 weeks. Within 5 days up to 2 weeks, again LAD. Free wall rupture leads to tamponade, pericardial effusion leads to tamponade. So we know the Bextra, hypotension, distant neck vein, and distant heart sound, and the finally left ventricular aneurysm. Up to several months, it is again LAD. Up to several months, left ventricular aneurysm. Left ventricular aneurysm, there may be heart failure, angina, and ventricular arrhythmia. In here, there is thin dyskinetic myocardial wall. Thin dyskinetic myocardial wall. Okay, left ventricular aneurysm. This one is a very high yield left ventricular aneurysm. There may be scar tissue deposition. It happens up to several months. There may be scar tissue deposition following transmural MI. Several months following MI, there may be heart failure, angina, and ventricular arrhythmia, and systemic embolization. There may be stroke. And ECG show very high yield. Persistent ST elevation and deep Q. Persistent ST elevation and deep Q. Echo shows thin and dyskinetic myocardial valve. Complication is arrhythmia, arrhythmia, and MR. Distortion of left ventricular geometry results in papillary muscle dysfunction and mural thrombus. This is the left ventricular aneurysm. There is ST elevation. This is persistent ST elevation, deep Q, persistent ST elevation, deep Q, persistent ST elevation. in leads corresponding with previous MI. In leads corresponding with previous MI. In here, there is previously myocardial infarction happens in lead V2, 3, in 4. In V2, 3, 4, there is previous MI happened. Now there is deep Q and persistent ST elevation. Looks like left ventricular aneurysm. Um, Fibrous scarring of the myocardial wall following transmural ST elevation. Myocardial infarction most commonly affects the LAD territory. What is the most common cause of sudden cardiac death? In the immediate post-infarction period, in patients with acute MI, reentered ventricular ventricular fibrillation, ventricular arrhythmia, there may be ventricular fibrillation. Okay, that's all about the complication of post-MI and left ventricular aneurysm. Hope you enjoyed my video.